We've got breaking details continues.
Plus, for some people battling cancer, a new test could help make their fight a little easier. Advanced genetic testing is becoming more common as a way to identify the best treatment options for cancer patients.
One local woman with metastatic colon cancer recently had the testing done, and it completely changed the way that her doctor is treating her. Allison Starling explains today in 7 on your Side Health Alert.
Windmill up into Warrior 2.
37-year-old Jen Morey is a dedicated yogi. She uses it to stay fit, but also to gauge how she feels 1 year after being diagnosed with stage 4 colon cancer.
You're fighting for your life. You're, doing everything you can to stay alive and stay as healthy as possible.
Morey has had a particularly difficult time with side effects from her treatment.
I was having severe abdominal pain. I ended up in the emergency room.
That is why Dr. Michael Pishvayan at MedStar Georgetown University Hospital decided to send a biopsy of her tumor for advanced genetic testing.
When we're looking for these genes, we're not necessarily looking for something that's well known. We're looking for something that's not common in their cancer, and that's what I would call the needle in the haystack.
The test found she is HER2 positive, very common in breast cancer patients, but quite rare in colon cancer, only affecting 2 to 3% of patients.
I was very excited when I saw her results because I knew right away that we'd be able to have additional treatment options for her.
It opened the door for Dr. Pishvayan to treat Morey with breast cancer drugs, which are more plentiful. After several cycles on a drug called Herceptin, a CT scan has found that Morey's tumors are stable. Dr. Pishvayan says that's a good step and hopes over time her tumors might even shrink. Morey says her quality of life is improving as well, and if that continues to be the case, she'd really like to return to work.
You're just trying to have quality of life and do things that you enjoy doing because you don't really know how much time you have left.
The biggest barriers for genetic testing include cost, the length of time to get the results, and difficulty in getting biopsy samples. And while it's being used now in many types of cancers, it is not used when a patient has what's considered a curable cancer. Allison Starling, ABC7 News.